As you might imagine, the well wishes are pouring in for Alex Trebek. The longtime Jeopardy host revealed yesterday he's been diagnosed with stage 4 pancreatic cancer. Trebek is vowing to fight it, but pancreatic cancer has the highest mortality rate of major cancers. We are joined now by Dr. Peter Yu, physician-in-chief at the Hartford Healthcare Cancer Institute. Thank you for joining us, doctor. We appreciate it. First of all, can you explain what stage 4 is, what that means, and how Mr. Trebek has any kind of chance to beat this?
Absolutely, Mike. Stage 4 pancreatic cancer means that the cancer has spread beyond the area where a surgeon could get in there with any hope of curing the patient. And really, the only hope of curing this devastating disease is through surgery. So stage 4 indicates cancer has spread.
Now, we've all heard that pancreatic cancer is nearly a death sentence, a very low survival rate. Is there anything you can do to try to increase your chances, or is that impossible?
Well, we definitely applaud Mr. Trebek's courage and his grace under pressure in making this public his illness and his strength in fighting this. But the odds are quite difficult. There are very few patients who survive more than a year after diagnosis. I think the fact that he appears to be in good health and is not suffering from a lot of the consequences of disease is strongly in his favor. But it is a tough battle he faces.
So, Dr. Yu, are there any signs? Do people notice any difference in their physicality when they start learning that they might have this?
Well, they do. Without going into a biology lesson, you have to understand what the pancreas is. The pancreas is basically an organ of your body that helps you digest food. And so when something goes wrong with the pancreas, people start noticing loss of appetite, weight loss, trouble with digestion. It also is located, the pancreas is located towards the back, pressing against a very large nerve called the celiac plexus. And so very often another sign is this gnawing, constant pain radiating to your back is another sign. And the other thing the pancreas does is produce insulin, which keeps your blood sugar level down. So a rising sugar level is also a possible sign. And really the constellation of new onset diabetes, back pain, weight loss are all early signs. A later sign is something called jaundice. So one of the things that the pancreas is involved in is digesting food with the bile acids, and they frequently get blocked from the pancreatic cancer, and that results in jaundice, or the eyes and skin turning yellow and the urine turning dark.
One last question before we go. You hear other things that you can do sometimes with diet for other kinds of cancers and other things preventative, but is that the case with pancreatic cancer? Can you do anything to try to help prevent it?
Well, it is associated with tobacco use, so certainly not smoking is an important factor, and obesity is also a risk factor. But I think the most interesting thing we've learned is that there is a genetic component to this. So work now done at Memorial Sloan Kettering and other places have shown that about 15% of patients with pancreatic cancer have an inherited gene that predisposes towards pancreatic cancer. And that's an important message for families where pancreatic cancer is occurring in more than one family member, that perhaps they should have genetic testing done under the guidance of a physician and genetic counselor to understand their risk and perhaps develop a customized surveillance program.
Dr. Peter Yu from the Hartford Healthcare Cancer Institute, we appreciate your time and your advice tonight. Thank you.
Very welcome.